Prime Ministers and DMS. Thanks for taking my question. So, earlier on, DMS did give some information about recent cases, but I have some about the recent deaths involving some younger people, as well as some who have been vaccinated, but actually don't have any underlying conditions as well. Wondering if we could find out any more information about these cases, for those that have been vaccinated. Was it due to did the vaccine not work for these people, or how did the treatment work out? Why were they still affected by COVID so greatly?
Thank you very much for your question. It's important to acknowledge that the vaccinations do give some level of protection, but it's not 100%. So there will be people who still get infected despite the fact that they are vaccinated. And the data I mentioned earlier and shared did share what that relative risk was. On the balance, it is still more risky to continue not to be vaccinated than to be vaccinated in terms of getting infected, getting a severe infection, getting into the ICU for care, or even dying. Those who had vaccinated, in fact, had protection to the extent where their risk of getting into the ICU of dying was comparable to someone who was unvaccinated at a much lower age. So a person who was age 80, who is vaccinated, now has a comparable risk of getting a bad outcome, similar to that of a person who was in his 50s and unvaccinated. So in that sense, it's clear that vaccination does protect. But because it is not 100%, there will be some who unfortunately do have a more severe cause and unfortunately may pass away. In the data that we've seen, these are almost invariably those who have chronic medical conditions, those who already may be frail, and who have a lesser reserve in their body, such that the insult associated with the COVID-19 infection causes them to be very, very sick. And I had shared just now what some of these conditions were that were associated with a worse outcome in both the unvaccinated and in the vaccinated group. This applies also for those who are much younger, who ended up in the ICU, and unfortunately, there have been a few young individuals who have passed on. They were also with these severe other medical conditions, independent of COVID-19 infection, that made them weaker, more vulnerable, and more susceptible to more severe infections and a bad outcome.